Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.
Hello and welcome to Aging Matters. This is a program that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. We have a great show tonight and I'm not even going to warm up into it. I'm going to turn it right over to our special guest and welcome again John Vogel. He is here tonight as a Medicare specialist, but I call him the volunteer extraordinaire.
Well, thank you very much.
I always love to have you, John, because you provide us with so much important information for seniors, and so we get a little bit of your time to share that with us tonight. In tonight's show, we're going to talk about Medicare. Right now, we've got going into what they call annual open enrollment. So we're going to talk about that, but before we start on that, let's rewind just a tad. And let's talk about, you wanted to just begin the show by talking about the Medicare books that are coming out or came out.
Yes, the new Medicare and U book, which is printed every year, Ann, and sent out to everyone that is a Medicare beneficiary. This is the 2019. Usually I would say this book is probably a good thing to have as a sleep aid, but this year they've actually done something really, really nice about it. And if you go to the back of the book, Ann, you can find where it says Medicare prescription drugs right in Pennsylvania.
Okay.
So instead of just throwing this into a pile somewhere and not looking at it, if you really want to take a quick look and find out what plans are really here, not just in Berks County, but all the way across the state. All of our prescription plans are nationwide anyway, so we don't have to worry about it. But they've actually put in this book for the first time ever. They separated it out. So we do have in our Medicare and U book for 2019 a very simple place to go to and find plans that are really affecting and part of us that we can make choices. So I find this book much more beneficial this year than even just last year's book. So it's really excellent.
And does this automatically get mailed to a person who's already on Medicare?
Yes, anyone that's already on Medicare.
And then somebody who would be eligible in 2019. I know that usually we at our agency get some of these books, so you should be able to access that if you want to call our agency.
Yes.
Probably they don't automatically send it. If
no, they don't. Somebody who's new going into Medicare would actually make a request, or they could get it asking me or asking the Area Agency on Aging. Can very simply get some, and you usually get a whole stack of them to be able to hand out. I do too. I get usually. So if they need them, they can. And it is very good reading, and it does make sense to understand this, but this year, with that ability to go quickly to where you need to go, boy, that's really an important addition to that.
Good.
An important addition. Yes.
So look for that coming out. And the other thing that I know that John wanted to we're passionate about and want to make sure people really have been reminded. We did a show on the actual new Medicare card. And we talked about how that was going to be revamped to take away the other identifier. The past identifier was your Social Security number. And in cases of scams and things like that, they wanted to not utilize that anymore. So John's got the samples, too, to tell us which is old, which is new, and should we have gotten them, or are we still getting them?
Yeah, it's fairly simple. Pennsylvania was one of the states. We were a guinea pig state. There were 5 states that were selected to get the new Medicare card first, and Pennsylvania was one of those that came out first. And what you're seeing on the screen is the new card.
Okay.
If you're still having in your possession your existing card, which would have your Social Security number on it, the first instruction you're going to get is to tell you that you should destroy this immediately. I'm going to tell you that hang on to it until December 31st, 2019, because you can still use this. So if you didn't get your new card, if you didn't find it, don't panic that you can't go to the doctor because you don't have insurance. You do have it, and you can use your existing card. The idea is that the new cards have come out, and the majority of people have received them. I did a presentation yesterday here in Berks County, and 2 people came to me afterwards and said, I did not get my new card yet.
Okay.
So it's come to the point now where Social Security and Medicare has said there is only one source to be able to get the new card, and I highly, highly recommend that you do and go and get your new card as soon as possible. But it's an 800 number that you have to call. So anytime that I share that it's going to be an 800 number, usually means people are going to, oh no, now how long am I going to be on the phone and all that. But it is an 800 number, 800-633-4227, which is the Medicare, they call it the Medicare hotline. It is specifically designed for the new cards. For the new cards.
So if I haven't gotten
number,
it, you can go ahead and call. You should have probably received it, and if you didn't, it's wise to call.
It is absolutely, at this point in time, absolutely you should. One of the reasons that's scaring people beyond anything else is the question of, well, why didn't I get my new card? Well, if you changed your address recently, within the last 2 to 3 years, if you changed your address and you did not tell Social Security or Medicare, that's probably one of the reasons that you're not receiving it. If you're not receiving your annual statement from Social Security telling you what benefits you received and what benefits you will get for the next year, that's another indicator that you did not get your new Medicare card, and you won't ever get a new one because they don't know where you're at. So then you must call this 800 number. So please don't panic that if I didn't get a new card, I can't go to the doctor, I can't get some. You can use your existing card, but I highly recommend, please call the 800 number. It costs you nothing. It's an 800 number. It's 633-4227, 1-800-633-4227, and they'll answer the phone and you can get a new card without anything. It's a very simple process to be able to do, but it's really, really, really important, Ann, that they do go after getting their new card.
And as we saw with the quick sample, the coloring is similar, the red, white, and blue.
Yes.
But if they notice where that ID was, it was very much the scrambled numbers. It looks really weird.
Yes.
It's a mixture of numbers and letters. So it looks like it's random scrambling. But that's a good thing because it certainly cuts down on the identity theft and things like that.
It will protect you from the standpoint that the card. The only thing I do that scares me a little bit is the fact when you look at that card and as you're looking at it there, and when you get your new one, you will see you will have no place to sign your card. We've always been able to sign our cards. On the back side of the card there is an open space where you can sign the card. Whatever you do, please sign the card before you have it laminated. And people ask me that all the time. Am I allowed legally to laminate my card? Yes, you can laminate your card. But please sign it first and put it on, because for all kinds of reasons, if you drop it, if you leave it somewhere, God forbid somebody steals it, you know your signature, and you would be able to prove that you were not the person that is using it illegally. So
good.
Check out the new cards.
And then call us. I've got that number too if you need it, if you didn't catch it tonight. So let's move forward now. We've got the new books coming, and with that, what we wanted to talk about was that it's coming up soon for what they call annual open enrollment. So tell me what that means.
Every year since 2007, the federal government through Medicare has given every beneficiary the opportunity to change their plans. They call it their annual enrollment period. For most people, they got used to the term open enrollment period, and you are allowed to go and take a serious look at what coverage you have through Medicare and change your plan. It starts this month on October the 15th, so we're coming up to it very quickly. It ends on December the 7th. So it's not a huge period of time, 6 weeks a period of time.
Not even 2 months.
So you need to make a decision on there. And I caution everyone to say, if you believe my plan's absolutely perfect, there's nothing wrong with it, it's been going along absolutely perfectly, I don't want to get into the hassle of having to change a plan during that time frame. Those are the people who in January, February call me up and say, oh my gosh, I didn't know my plan changed so much. Can I change? No. No. October the 15th. December the 7th.
Okay.
Even on December the 8th, if you call me and say,
Oops.
we can have a nice discussion on the phone. You can even buy me lunch, but there's
Nothing you
nothing
can
we
do.
can do. So October the
And
15th.
again, it never hurts to actually always evaluate what you have as a current coverage, and because conditions change throughout your year, and so it's always good to relook at what you have and if it's still workable for you. I want to, before we talk about what we can do with open enrollment, I hear people all the time get confused, and I think I just want to ask you to define for us. People just use the general term Medicare. Oh, Medicare covers it. But we know there's parts, we've got sections, I guess, of Medicare, I don't know how else to put that, with different, that the coverage for certain things through Medicare covers certain, I don't know, other than to say things. So can you tell us,
Yeah,
you know what I mean by the divisions?
Medicare within itself is made up, and if you look at your card, you will see that you have a Medicare Part A. Part A behind there says the word hospitalization. It is when you are actually physically admitted into the hospital. It also covers some of the skilled nursing facilities. It covers some home health care, and it covers your hospice care. So Part A of your Medicare, for 98% of the country, is free. It's not free for everyone. There's some that do have to pay a premium for that, and it is quite costly. Quite costly. So Medicare Part A is your hospitalization for the general public. Part B is what we actually use. Those are the people like myself who are a Medicare person. Part B is your doctors, your specialists, your x-rays, your lab work. All those things, if you have to go get an MRI or a CAT scan done, all those things that are done outside of being admitted into the hospital, including that you would be in emergency. Your emergency, including,
because you're not admitted.
Including transitional care. That's all included in there. So your Part B is what you and I as normal people would say, that's really what we use as our Medicare. What does Medicare do for me? Well, it covers my doctors and all those good things. Medicare Part B is not free. Medicare right now, Part B, is $134 a month. It is normally simply deducted from your Social Security benefits. But if you're not collecting your benefits, and I have more and more people who are not collecting because they were waiting for 66 or even waiting for 70, you are billed quarterly. So you can still have your Medicare Part B and pay it. It's just that you are billed quarterly. Both Part A and Part B have a deductible, and that's the part that people have to pay attention to. If we all remember, what is a deductible? A deductible is you pay first before we pay anything. So Medicare Part A has a deductible for 2018, it's $1,340, meaning that we would be responsible for the first $1,340. Part B has a separate deductible. It's $183 for 2018, and again, we would be responsible for that first part. So Medicare within itself, when you receive your red, white, and blue card, you will see on there Medicare Part A, hospitalization, Medicare Part B, all of your other care. So it's a very simple process to understand what you received. It gets more complicated because back in 2007, Medicare decided to add Part D. And Part D is our prescription coverage. So even though it does not appear on your Medicare card, it does not show anywhere there, because Medicare Part D is something you can select and pick a plan that works for you under all kinds of circumstances, and we'll try to get to that tonight so that you understand how that works. But Medicare Part D is part of the Medicare system. So you have A, you have B, and you have D of the basics of what does Medicare do for us. That's what it is. That's basically where we're at.
Okay. So when we're talking, we'll go right into the open enrollment piece. So because I may or may not have that book and may or may not have all the answers, how should I begin if I want to say, okay, I know that's coming up, and I've heard the show tonight. I want to start thinking about what it is I have and seeing if it's still working for me. What do I do? And how do I begin that to go somewhere or get some help? And then let's talk about what can I do then during that open enrollment time frame, during this time frame.
The hardest question that people come to me is constantly saying how confusing Medicare is. Medicare within itself is relatively very simple. You only have two choices. You can go into Medicare Advantage plans, HMOs, health maintenance organizations, or PPOs, preferred provider organizations. That's your one choice on this side. On this side is you can go into something called Medicare Supplemental, sometimes called Medigap policies. They both play with your Medicare. If you go into a Medicare Advantage plan, then your Medicare, even though you continue to pay the Part B premium, is suspended. It's out here in space somewhere. You receive no benefits from your Medicare A or B if you're in a Medicare Advantage plan. What you have done is agreed to whatever plan you pick from, whatever provider is going to give you your health care, you follow then their rules to whatever, and it's all different kinds of situations where you would have a premium. And the premium could be zero, Ann, but the premium could go all the way up to $289.
Okay.
So you will have a premium. In every HMO or PPO plans, you will have co-pays. So when you go to the doctor, you will be paying them something, or the specialist, or your lab work, or anything else that you get done. You may or may not have a deductible. The deductibles for 2019 are $0 to $1,895. Now, I just said it was $1,300. No, but when you go into a Medicare Advantage plan, you have to play with what their existing rules are.
So the first decision I could make if I'm looking at open enrollment is either if I'm already in it and I've got the traditional, I'll call it, I could look at staying with that and looking at then if those premiums and deductibles have done any changes, and or I could make a switch into an Advantage plan, and that's what you're saying.
You could stay with a Medicare, traditional Medicare and a Medigap supplemental policy, or you could go over to that. During the October 15th to December 7th time, if you're in original Medicare, you can switch. You also can pick up a supplemental policy, a Medigap policy. You can do those kinds of things during the open enrollment period. You can switch from a Medicare Advantage plan to another Medicare. You're not stuck. All of these plans are annual. So you have the opportunity each year during this time frame to say, I don't want that plan anymore. My doctors don't take it. My hospital doesn't take it. I can't use my plan. I need a new plan. You can switch to another Medicare plan.
So I'm glad you said that, because it's something you just said as far as when I'm looking at making those switches and the changes and looking at what my needs are, I'm looking at what my needs are, what I can afford, in terms of looking at my deductibles and the premiums for each of those things. But also, you said, what does my doctor or the other specialists or whoever I'm going to accept?
Correct.
Right?
Correct.
So that's a consideration.
One of the key ingredients of a Medicare Advantage plan is understanding your network. That's the term they've brought out in this. Do we understand our network? Can you cross lines on networks? Can you go to out-of-county services? So under the Medicare Advantage plans, they have in-network services and out-of-network services. So you could possibly go to another county, another state, and get services, but you would be paying a higher fees, higher deductibles, higher co-pays, higher out-of-pocket money. So it is possible to be in a Medicare Advantage plan and have coverage outside of just Berks County here, but it becomes quite a bit more expensive. So you need to look at that. And of course, you can change your prescription plan. And I will personally tell you that myself, I've changed my prescription plan 7 times. So yes, prescription plans, and my prescription plans,
Sorry.
they work perfectly. I don't have a single solitary problem. It's going along absolutely wonderful. And all of a sudden, here comes open enrollment, and I find out that my premium doubled. I find out that my co-pays for my drugs doubled. I find out that they're not going to cover the prescriptions that
That
I
you've
take.
been taking.
So you have, and thank goodness that somebody came up with this back in 2007, you have the ability between the 15th of October and December the 7th to change your prescription plan.
Okay.
So it makes it very simple, especially if something occurred during the year and you
Yes.
changed medications. The doc says, I need you to be on this medication.
Yeah.
Something occurred health-wise and you needed to do something. You have that ability to change your prescription plan. So change is it's a good thing in the concept of what Medicare can do, because it allows us, and I don't want to confuse people, because it really is only two choices. You go on this side to Medicare Advantage plans and we look at them, what is it going to do for me? And we look over here and we say Medicare supplemental insurance and my prescription plan, what's it going to do for me? But it gives you that opportunity. What people get very afraid of is the fact that right here in Berks County, Ann, we have 45 different choices of Medicare Advantage plans. That's where the confusion
Okay.
comes in. It isn't a
Yes.
matter that it's the Medicare Advantage plan is a confusion. The plan
Okay.
isn't confusion. The confusion is that there's 45 choices.
And particularly if I'm looking at saying, okay, I'm looking at which one covers what, and
You
I'm
got
saying,
it.
well, I kind of need this, and I know I need this, and I know I need this, and I'm reviewing the plans, I could spend quite some time looking at 45.
Absolutely, absolutely. And one of the key ingredients there, and we just said about it, and without using all kinds of terms, is your doctor, does your hospital, does your medical provider accept your plan? That's the key ingredient. Whoever you talk to about this, makes no difference who the first question you want to make sure that they know that your doctor, your specialist, your hospital, where you get your lab work done, do they accept my plan? Because you don't want to go and get $400 worth of lab work done and they tell you, I'm sorry, we don't take
Well,
your
it's
plan.
$400, and you thought it was going to be
It was going to be covered.
Well, and I think the other thing too is that people, you don't want to just look at, I have such a low premium. People will, they're talking to each other.
Yeah.
And so this one says, oh, well, my premium is this. Oh, well, I chose the plan that had, this very small premium or small deductible, whatever. And yet, again, because all of us are so unique, that may be workable for this individual. It still may not be, and they didn't realize that, yes, but each time you're going here, it's costing you more than if you had paid this amount in the plan.
Yeah.
So it's not just looking at the lowest amount of something either. It's
No.
where am I
Yep.
at this time that I have open enrollment, knowing that next year I can change again if something should happen medically to me or changes in the prescription meds, and know that it may not be the same as my, even a spouse or neighbor or friend. So.
I can't tell you how many times I've heard that, well, my sister-in-law says this absolutely positively is the best plan on the planet. You're absolutely right, Ann. It works wonderful for her, but she's not taking the same meds.
Right.
She's not even buying her meds at the same pharmacy. She could be going someplace different, whether she lives down the street or across the country. Her particular issues belong specifically to her, and you need to know exactly what we're going to do.
We only have a couple minutes left,
Yep.
so what did you want to say something
Well,
about,
yeah,
like the
let me
prescription?
quick say some things
Part
about
D?
Part D, because Part D changed very much so this year. We all know about the infamous donut hole. It's a gap in our coverage. We were all told that the Part D donut hole was going to go away. It was going to go away in 2020. What they did, the federal government changed it. They got rid of part of the donut hole for January 1st, 2019, but it's only going to be effect for brand name drugs. So I'm going to give you a really quick example here. If you happen to be a person that's on a rather expensive medication, something in the 300, 400, 500 range, what will happen on January 1st is you will now pay 25% of the full cost of the drug. Makes no difference what pharmacy you get it from, makes no difference. You will now pay, starting January 1st, 25%. Wow. That is only for brand name drugs. You will pay, we still have the donut hole. This is the confusing part. We still have the donut hole for generics. So when you go into
Okay.
the donut hole and the generics, you'll pay 37% of the cost. But for most of the people who are used to paying when they get their prescription in January, February, a $45 copay or a $47 copay, that's not going to happen any longer. When you buy your prescription the first time, especially if you're in some diabetic prescriptions that have some very high cost to them, when you walk into your pharmacy, that pharmacist is going to say, that's $130. And you're going to go, no, it can't be. I only pay. And on January the 1st, 2019, the donut hole is going away for brand name drugs, and you and I as consumers will now pay 25%.
Okay.
So that's really, really important to know.
Well, I'm going to just ask you here for the 2 minutes we have left. There is so much more. Obviously, we could talk for a long time about this, and John is a wealth of knowledge. I guess what I would ask is for those folks watching who go, oh, okay, that's coming up, and others that we can still promote the open enrollment. How do folks? Where can they go? Who can they contact to know how can they get help if they don't want to do it on their own? They want to make sure they're making a good change. They want to have somebody say, hey, this is what sounds right to me. Can you help me or verify, is this what I'm seeing? Where can they get help?
Besides coming to the Area Agency on Aging, which is obviously a phone call into them, Berks Encore has the contract for the Apprise program. The Apprise program in the state of Pennsylvania is the same as the SHIP program everywhere else in the world, the Senior Health Insurance Program, the State Health Insurance Program. You can go anywhere you want to and find out about this by contacting Berks Encore, 610-374-3195. I know their number by heart. You can contact them. There are 6 sites around the county. So you can go up into Strausstown, you can go to Wernersville, you can go to Birdsboro, you can go to Shillington, you can come downtown. There are sites around the county, so you don't have to just come into town.
And people will be set up with computers at those sites.
They'll be set up with an actual counselor. They will see a personal counselor. I'm a personal counselor for this, but they will have a personal counselor who will review every part of their coverage, what they're thinking, what it is. We don't make any real recommendations. We don't say this one's better than that one, but we will tell you that this is how this works, and if it works within your range of what you can afford and everything that you need to be covered would be covered. That's why you want to come and see someone who is an Apprise counselor, trained Apprise counselor.
They can call Berks Encore, they can call our agency, the Berks County Area Agency on Aging at 610-478-6500 to get information on how to contact Berks Encore, to call or to register to get to those sites to have a Price Health Insurance counselor help you with this open enrollment time. In the few seconds I have, I did want to let every other folks know also that there's a special event coming up later this month as well on Saturday, October 20th. There is a scam symposium. It's Scams Against Senior Symposium. It is open to everyone, focusing on really learning how not to be a victim, learning the types of scams that are out there, to be aware of them, to know what to do, what not to do, who to report to, things like that. It is Saturday, October 20th, 8:30 to 12:30 at Scottish Rite Cathedral, which is in West Reading, right next to the Reading Hospital. If you need more information, again, you're welcome to call me for that. There's a pre-registration, but it is free, so I hope that folks will come out to that. And John, I thank you so much for that information. Call us, Berks County Area Agency on Aging, for more information about all of these programs that we have, and thanks for tuning in to Aging Matters.
Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.